Hi, and welcome to Module 9. In this module, I'd like to go over some coaching strategies for 5 conditions that you will most likely see in your clinic or your practice, or maybe you're already treating, so we can add more tools to your toolbox, more resources, more ideas, and again, like I said, more strategies. So if you're ready, grab your handout for this module or just follow along and we'll dive into Coaching Strategies Part 1. There are 2 coaching strategy videos in this program, and this is going to be Part 1, and we will be covering these 5 conditions: diabetes, depression, allergies, high blood pressure, and arthritis. We have already gone over these conditions in previous modules, but now I want to kind of put it all together and come up with some concrete strategies for helping these individuals, these populations. I also want to start with a little bit of a foundation of coaching and giving you some ideas of how to make your coaching more successful, whether that is your full-time thing or you just want to add it to your lifestyle or offering it to friends and family, or you want to add it to your practice. So the first thing I ask people, students, somebody that is coming into a coaching position is, what is your philosophy of patient or client care? Like, what's your philosophy? Do you want to do the best for all your patients and empower them to make healthy choices? What is it? Do you have that statement for yourself? If not, here is a way that you could possibly create that statement for yourself and then have a strong foundation from which to offer your coaching services. So this is a nice foundation, a great place to springboard from as we go into coaching and strategies for doing same. So you, help, assist, or whatever word you want to use there. What? Who is it? Who are you? Who is your target audience? I work with a woman who works with menopausal, perimenopausal women that want to lose weight. That is her target population. That's who she works with, and she helps them make healthier lifestyle choices and healthier nutrition choices to reduce bloating and the symptoms and issues, complications around menopause. So you can get really specific, and I recommend that you do. So here is one way to craft your philosophy of patient or client care. I help or assist whom? What is your target audience? To do what? What is their immediate goal? Is it to lose weight? Is it to feel better? Is it to reduce symptoms, to manage a specific condition? Or maybe it's just overall health coaching to become more aware of what they're eating and that it really affects their overall physiology and their mind, body, and spirit. So I help, assist, or what word you choose, target audience there to do what? Through, what are your methods? Coaching, programs, one-on-one visits. What are your modalities? Maybe it's through a session that includes acupuncture and coaching and nutrition. And so that, what's the greater vision? And it's a vision statement that ends this whole philosophy statement, meaning so that they live their best life, or they live life feeling the best in their body. It's up to you, but I found this to be a really helpful framework for creating your own philosophy of patient or client care. That's a good place to start. Then the next place to go from there is also tied into your philosophy and your approach to coaching. I like what I call the CORE Circle L. So CORE stands for compassion, no judgment. If you find yourself judging your client or your patient, find a way to not judge them, because they will feel it. It will be in the little energy between the two of you, or refer them out. So have compassion with no judgment. Also, establish objective measurements. I cannot stress the importance of this. However you establish objective measurements with your patients, please do so. Whether it's you are tracking a pain scale, like a VAS scale from 0 to 10, what is your pain? Or what is you could use a MyMop, which is an objective measurement scale that you could do with all your clients or patients before they start seeing you, and then see them for 3 months, and then take those assessments again to have objective measurements of the progress and efficacy of your efforts for reducing pharmaceuticals, or even if somebody's taking something over the counter and they want to get off of it and go more natural and use your supplementation, you could say, okay, great. Before we started working together, you were taking 800 milligrams of ibuprofen twice a day on average, 5 days a week. And now after working together 3 months, you maybe take 400 milligrams of ibuprofen once a week. To me, that's progress. So find a way to objectively measure with your clients and your patients. For things like depression or something, anything that feels a little bit tricky to objectively measure, you could come up with episodes, right? So for panic attacks, anxiety, or depression, I like to give somebody, do I have one here? I do. One of these awesome at-a-glance calendars. This one happens to have puppies. And you could buy a whole box of these. They're 50 cents to $1 at the dollar store. And I give it to the patient or the client when we start working together. And they record at a glance. Remember when we used to have at-a-glance calendars? Anyway, they record different things like episodes or sleep or whatever it is that you're measuring them on for efficacy, and then you can look at it. And I do recommend, you'll hear me say this a lot in the coaching section, that you work with somebody at least 3 months. So you'll have 3 of these months to look at a glance to see the progress. People forget how far they've come because they're with themselves every day. And so it's really fun to look back. I've had patients that have had 3 or 4 of these little books, and we'll look back on 3 years ago at whatever patterns that were there that we were able to break through. And it's amazing to see that progress. So these little at-a-glance calendars are really helpful tool when getting objective measurements. So that's the O in core: compassion, no judgment, objective measurements, results-driven programs. So people aren't coming to you for coaching. They're coming to you because they desire an end result.